Hi, I'm Nancy O'Neill. What does aging gracefully mean to you? Well, it means something different to everyone. No matter what age you may be, Aging Gracefully on Suncoast FYI offers advice that could help you live a healthier life. Each week, we hear from a variety of specialists on a wide range of subjects. So please join us for Aging Gracefully on Suncoast FYI. Our cosmetic breast surgery discussions with Dr. Sessa continues this week on the subject of implants, for those who already have them and how to keep them healthy. Thank you for being back with us again this week.
Yeah, great.
This has been an interesting series. So today we're going to talk about how does one know if their current implants are still healthy?
So, I guess that brings up the conversation of something called capsular contraction.
Mm-hmm.
So all implants are seen as a foreign body. So your body sees these just as it would if you had a splinter in your hand.
Mm-hmm.
And what your body does physiologically is it scars it. So it sees it and it forms a very thin layer of scar tissue all the way around it. So it's like takes the same shape as this implant.
Mm-hmm.
Now,
Mm-hmm.
over time, in a small percentage of those people that get implants, between 5 and 30%, the scar tissue will start to strengthen and will start to thicken. And as that happens, it squeezes the implant. And as it squeezes the implant, it turns it sort of round or misshapen, if you will.
Mm-hmm.
Sometimes if you have anatomic implants, you could actually rotate them and then sort of, now you have a breast that's very misshapen because anatomic implants are made to sit like this. So in those situations, you would know because your breasts look sort of round, they look stuck on,
Mm-hmm.
they may be hard, and they may be painful. There are grades of capsules, grade 1 through grade 5. And grade 5 would be misshapen, high, distorts the breast, and painful, and varying degrees of lesser in nature. So a lot of times I'll see saline implants where a patient will come in and their implant will be deflated. And it's not because the valve failed, it's because the capsule put so much pressure on the valve that eventually the pressure from the scar tissue caused the implant to fail. And then a deflation occurs. So most women have no idea that they have a capsular contraction. A lot of times it's their friends that will say, why do your implants look so hard, or why do they look so round?
Mm-hmm.
And then they will say, well, I thought that that's the way that they were supposed to be. As a matter of fact, a person that works for me had no idea that she had a grade 4 capsular contraction until I told her. And she's around implants all the time in consults and hears me talk all the time.
Mm-hmm.
And she had no idea. So if she has no idea, I know that the general public has no
Sure.
idea. And as I alluded to earlier, there are roughly 400,000 to 500,000 breast implant surgeries done yearly in the United States. And of those, if there's a 5 to 15% capsular contraction rate, there's millions of women that have this issue and have no idea that they even have it.
Now, what can be done to help with this? What can you do?
So, two things. Number one, you don't have to do anything. If you're content with having a harder breast, a breast that's not real natural feeling, then you don't have to do anything about it.
Mm-hmm.
It's not going to cause cancer. It's not going to harm you in any way other than cosmetically distort your breast and cosmetically be hard. So if you decide that you electively want to have it removed, there are things that we can do for it. Sometimes just massage will help it. Sometimes little things like ultrasound treatments will help soften it. We use certain medications and some supplements that also help help remove it. One of the supplements being milk thistle. It's a detoxifying supplement that's really wonderful for your liver. But milk thistle has been shown in some studies to actually soften capsular contractions. But ultimately, usually it ends, if it continues, it requires surgery. The surgery that's required is I open the pocket, remove the scar tissue, usually replace the implant. Sometimes, in some instances, I will use the same implant. But you remove the scar tissue totally, and that usually completes the process in 80% of the time.
Okay. Now, final question here. What happens if a silicone implant ruptures? Now, I would think that the saline, as you said, is a natural product. What happens if a silicone implant ruptures? What can be done about that?
So, as far as saline is just sterile salt water.
Sure.
So if this deflates, you're just left with just the shell, which is millimeters thick.
Right.
So it just folds down into nothing, and your body just reabsorbs the salt water. Silicone, the way that the silicone is made now, this grade being grade 4, grade 5 for the anatomic gummy bear implant, this silicone will not leach out. There was a scare 15 years ago where if this implant would be ruptured, that the silicone would leach out like motor oil, if you will, just leak out into your pocket, and then your body promotes an immune response to that silicone, which can cause a tender breast, inflammation, redness,
but
pain.
Now there isn't
but now,
such a...
now if this were to be cut or torn, you wouldn't even know if the silicone ruptured. So the only way to tell is with an MRI.
Okay.
Because it will not lose its shape.
Okay.
So in those instances, if people come in and they say, I've gotten a car wreck, my breast hurts, generally I'll send them for an MRI. And if the MRI shows that the implant has been compromised, the surgery is to remove it and replace it. You do not want a ruptured implant to remain in your body.
So if there's any questions, yes, definitely come see you and go from there.
Absolutely.
All right, well, it's been so much and so informative the last several weeks learning about all of these different perspectives on breast implants. So thank you so much.
Thank you.
Okay. Please stay tuned. Aging Gracefully on Suncoast FYI will return after a short break. Dr. Terry Dees returns to the studio today to share more on her weight loss program. Thank you so much for being back.
Thank you for having me back.
Look forward to hearing more about your program. And I'd like to start with, how did you get started in the customized weight loss program that you created?
Absolutely. So I'm a natural health physician, and what we focus on in our office is functional medicine, clinical nutrition, chiropractic, and rehab. My passion has always been weight loss because it was something I struggled with myself. And for me, I was always overweight as a child. I lost weight when I was 30, but I did it working out 15 hours a week. And after I had my daughter, who's now 2, I didn't have 15 hours a week to dedicate to the gym. So the plan that I lost weight on is exactly what we do for our patients. No drugs, no surgery, all natural, whole real food, and exercise is completely optional. And I've lost 64 pounds and have kept it off.
Well, that's the next thing. I mean, there's a lot of different aspects to the customized weight loss program. Tell us about some of those, and also how do people keep the weight off?
You know, I think that's almost as important, if not more important, than losing the weight in the first place. Because the more you yo-yo up and down, especially as we get older, the harder it is on your overall health. So we see women average about ½ a pound of weight loss a day. And in our program, men average about a pound of weight loss. So we have people losing weight very quickly in an extremely healthy way. And then we teach them we work on improving their hormone function and boosting their metabolism, and we teach them how to really reset that metabolism so that they can have results that last for the long term.
So you customize that to the individual. Is that what it's about?
We customize it for every single person individually. It's funny because we'll get calls on the phone, can you tell us about the program? And we always have to say, you need to come in and really sit down with me, because everybody's body is so different and people need different things.
Go ahead.
I was going to tell you one really good tip that I have for the viewers is if you want to know if you have a metabolic issue, take your temperature around 3 p.m. And if your temperature is low, it can be a sign of a metabolic issue. So a lot of people are like, I've been at the gym, I've tried every diet, I can't lose the weight. Well, you're going to need help from someone like me to help you overcome that in a natural way.
Okay, well that is very interesting. I've never heard the 3 o'clock. Is that when our temperature is kind of
if it's
regulated?
Low around 3 p.m., then it's a sign that it could be thyroid issues, it could be a metabolic condition, and then we use really high-grade nutraceuticals in combination with a whole food plan to help to support those different systems so you can be successful.
Okay, now when people have lost the weight, when you said a half a pound, I thought you were going to say in a week. And that was going to turn me right off. I don't know, because I've done that. And I'm like, well, this is really frustrating. But in a half a pound a day, that's amazing. And then, of course, lose weight easier. God bless them.
Oh, I know.
But once somebody has lost the weight, how do they keep it off? Because that is a huge problem. How do you help them through that process?
Absolutely. So it doesn't end with us. We give people a back end of lifetime support because life happens. So we want to be there to support them. We give them meal plans, shopping lists, we give them recipes, we help them with that reset phase so that they can be successful. And again, that looks different for every individual because people have different health issues, they have different needs, they have different lifestyles. So we figure out a comprehensive plan to help them be successful with that.
And how long do you work with them now? Once they've lost the weight, there's a transitional period where they have to stop losing weight.
Yes.
And then how long do you typically work with a client after that?
So again, it really depends on how much weight they need to lose. We found that with creating our program where you can lose the weight healthy in the shortest amount of time and then maintain it, we were much more successful than when it was like a half a pound a week because people burnt out. So they typically spend in that transition stage anywhere 3 to 9 months. It's different from every person. And then they have contact with me on an as-needed basis so we can help support them to be successful.
Yeah, that's what I was wondering.
And
they
everybody's
can come in
different
and see
with
you.
that. Yeah, everybody's different with what they need for that.
Now, many, many, many success stories.
Yes.
We heard one before, but I know you have another one that you would like to share with us today.
Yes, I want to share Gail, and this lady is just such a champ. Works a very stressful job in the legal field, which I've never met someone that's in that field that isn't like high stress on their paperwork with 4 check marks. Struggling with blood pressure and on medication. Like a lot of people, the weight just kind of crept on as the stress went up. And she's down 32 pounds. She's maintained her weight loss. She's off her blood pressure medication. Her energy's through the roof. She's happy. The stress isn't getting her the same way. We have seen a light come back on in this woman's life, and it's been so rewarding for me to help her through that journey.
And it does. I mean, it helps with your overall mental state.
Absolutely.
I mean, not just that. I mean, it just gives you a whole new outlook on life.
Absolutely.
Now, I know that you have a special for a number of our viewers, so can you tell us what that offer is today?
I want to give the viewers an opportunity that if they want to come in for a free consultation, we're going to make that available for the first 25 callers today. We're busy, so trust me, you've got a call, but we'll sit down, knee to knee, eye to eye, talk about what's going on with your health. If our program is a good fit for you, then lay out what it would be that we'd need to do to get your health back on track, lose the weight, and get you moving in the right direction for the long term.
Now, how long will the consultation take?
It's going to be about 30 to 45 minutes. And that's a great question so that people know how much time they need to dedicate to it.
But that's wonderful because they'll get an opportunity to talk with you and see if this is right for them.
Exactly.
I think that's wonderful. So be one of the first 25 callers today and take advantage of this awesome special.
Thank you.
Doctor, thank you for being with us again today.
Thank you so much for having me. Thank you.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. We'll return right after the break. We welcome Dr. Russell Sampson from Sarasota Vascular Specialists into the studio today to discuss varicose veins. Thank you so much for joining us today.
My pleasure, thank you.
There's a lot of misconceptions I know about this particular subject, so we'll get to those. But can you start with what is the difference between varicose and spider veins?
So varicose veins are the bulging blue veins that you see running down a person's leg. And they're big and they're obvious, they look like ropes. Spider veins are little tiny little pink, usually sometimes blue markings or blemishes on the skin. They don't really raise up.
Okay, can those come at any place on the body, or do they specifically?
They can occur anywhere, but strangely enough, they occur predominantly on the legs.
Okay. And what happens if varicose veins aren't treated in a timely manner?
Well, one of the reasons that I'm here today is to put to rest some of the things that you may see in advertisements, in magazines, TV, and newspapers about the dangers of varicose veins. I think people have to realize that the majority of times varicose veins are just a cosmetic problem. They very, very rarely lead to trouble. So when you see an ad on TV saying beware of your varicose veins, you could lose your leg or lose your life or get into lots of problems, you have to be very suspect about that advertisement.
Okay.
Because most times it's a very simple condition that we take care of for cosmetic purposes.
Okay, so that's basically what it is. So that's, I know, because for so many years I've heard that you know, these are very dangerous, detrimental to your health. So that is not necessarily true.
Very rarely. So varicose veins can cause pain sometimes. They can sometimes get a blood clot, but a blood clot in a varicose vein is not a dangerous blood clot like a blood clot in a deep vein in your body. And sometimes if you have veins for a very, very long time, you can get discoloration of the ankle and even an ulceration of the skin. But that's very, very uncommon.
All right. So in that case, then what would you do for a treatment for varicose veins?
Well, the treatments are the same whether it's for cosmetic purposes or for a real medical indication. First of all, you have to eradicate the varicose vein. So we have a very simple procedure under local anesthetic in the office. We make a tiny incision under local. We have a specially designed hook that grabs the vein, and interestingly, the vein's got no pain fibers. So when you pull it, the patient feels virtually nothing. Can I have your hand for a minute? So this is all that the patient will feel, a pulling sensation.
Oh my goodness.
They feel the skin moving. They don't feel any pain from the vein. We put a little steri strip on the incision, put the patient in a stocking, they go back to normal activity without even taking a Tylenol.
Okay, now, so how much of a vein are we talking about you taking out with this little
It's
procedure?
amazing. Through a tiny incision like this, we can sometimes take out as much vein as that. Now, some people will also have a vein that runs up the inside of the leg called the saphenous vein. It has valves in it that may not be working. And if that vein is very distended, very enlarged, and certainly not working properly, we get rid of it with what we call an ablation. And that's done under local anesthetic. Again, in the office, we use a device that burns the inside of the vein and destroys it. Not everybody needs that, and one of the reasons, again, why I'm here, a lot of people are having that procedure unnecessarily. So it's not only that you get an unnecessary procedure, but that's the vein that we use for, if we ever need to do a heart operation and we need an artificial artery, we use that vein instead of an artery. So if you've had that vein taken away by mistake or unnecessarily, and you ever need a heart operation in the future, you're out of luck.
Oh my goodness. That is something that, again, I've never heard before, so I'm getting quite a bit of medical knowledge that I appreciate, because you never know. I mean, this is the whole point about people when they're getting older. I think they need to have more than one opinion from someone. And I think
so when I was in New York, there was a clothing company called Cy Sims, and they always said their best customer was an educated customer. And it's the same thing here. If you're going to be having something done to your body, you should really know what's going on with that condition.
Okay, now we want to get into laser treatments because we hear so much about that now. What kind of laser treatments?
So again, everybody thinks a laser is something that's very gentle. In fact, laser works by heat. So the laser that we use is 1,000 degrees centigrade. So if we put that on inside your body and we didn't numb you up, you would go straight through the ceiling.
I guess.
So
oh my gosh.
the laser that we use is not some gentle magic wand. It's a specific device.
Okay.
Now we do use it and it is important, but it's not for the surface varicose veins. It's for that deep vein that I was telling you about, the saphenous vein. That's how we destroy it with the laser.
Okay, that's the ablation that you were talking
And that
about.
has replaced what we used to call a stripping operation. That procedure is virtually gone now.
Okay. Well, of course, you've made so many strides in medical
Technology.
Technology, thank you.
Definitely.
So all vein doctors are not created equal, and again, how do we know how they've been trained?
Well, the only specialty that's really been trained and certified by the American Board of Medical Specialties are vascular surgeons, so people that not only take care of veins but also arteries. There are other doctors that have been to courses that may have learned how to do these type of procedures, but they're not really specialists in the area. So if someone is looking to go to someone who really knows about veins, ideally it should be a vascular surgeon.
Okay, so that's the first thing that they should look for. Any other questions that come to mind that they should ask?
Well, I think they should know how many procedures the person's done, and if they aren't a vascular surgeon, where were they trained? Where did they learn the procedure? And what is their idea about treatment? Do they treat everybody whether they need it or not, or what type of testing do they do? Do they have a certified lab to do the testing? These are the things I think a patient should ask.
Okay, great. Well, thank you so much. I've learned a lot, and I'm sure our viewers have as well.
Hope so.
And we look forward to having you back very soon.
Good, thank you.
Thank you, Doctor.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. To find previous episodes, go to snntv.com under programming. See you next Saturday and Sunday at noon.